Okay. We're officially live now. So let's see if we can get that count up. All right. I'm going to go to my, Marilyn might be having an issue. Okay, awesome. To my, we'll wait until a few more people come on. Looks like some folks are coming in. We'll wait till Marilyn gets back before we actually jump out there. I'm adding back to the screen now. Yeah, some people. You make me fall in love with you. I don't know just what I'm gonna do. I looked out into empty space. All was the sweet face. Oh, baby, you make me fall in love with you. Kind of typing in. Marilyn, do you see it on your page?
I'm going to it now.
Okay. Remember we shared last night. I'm talking about 20 years up.
I don't see it.
Okay, remember how we shared it last night?
Yeah. And you're still an administrator, so you should be good.
Mm-hmm. Try it on the it was an easy share last night.
It was.
Mm-hmm. Looks like Reddrick just popped in. All right. Now all five of us
I
there.
did
Hey, Kristen. Hey,
apologize for the tardiness.
that's all right. How are you feeling today?
I'm good. I'm well. Hungry
Okay.
as always, but you know how my appetite go.
I do know how your appetite. Well, it's good that you have an appetite. Actually, can you see everybody?
Yeah, I can.
Okay. All right. Marilyn, I don't know what's going on right now with the
So
share.
did it come up? Did you hold on?
It's on the network.
And you selected Gullah Geechee Chamber and shared it?
All right, everyone.
You are
Thank you.
you're
Hold
still
on.
an administrator, so you're good.
Right, hold on. For everyone who's watching, thank you so much. We're just gonna play a little bit of music here in the background until we can get this share on some other pages. And we'll be on in just a moment. Everybody sit tight. You don't have anywhere to go, so sit tight. All right, so last night we did a simple share from network, right?
Yes. No, you did it from StreamYard, but it allowed you to do it.
It allowed me to do it last night.
Yeah, because I can't do it. Hey, everybody. Good to see you.
See you too, Miss Marilyn. Hi, Miss Lynah.
Hello, hello.
How you doing, Mr. Reddrick?
Pretty
Since y'all can
good,
see
pretty
each other,
good.
go ahead and do your introductions of one another to each other. How about that?
Okay.
Okay.
Ladies first.
Hello, I'm Lynah, and I'm the Community Relations Liaison for St. James Santee Family Health Center. We are a federally qualified community health center in Charleston and Georgetown counties.
And I'm Marilyn Hemingway, CEO and president of the Gullah Geechee Chamber of Commerce, and started it in 2018. And we promote African American businesses and other entities within the Gullah community. So we are from Florida, Georgia, South Carolina, and North Carolina.
I am Reddrick, cousin to Ms. April Garner right here. A positive
Reg, you're muted for some reason. Red.
Yeah.
Redrick, he's still talking, y'all, just like me. You're muted. We can't hear you. Yeah, no, we can't hear you. It's muted for some reason. It muted you. Did you just put your earbuds in? Make sure you're not muted on the screen. Come back. The devil's being busy. This was flawless last night.
Yeah, because last night I could not share it directly. You had to do it.
That's right. No, I won't do it.
Is it not giving you the option at all?
It's not giving me the option. soon as Reddrick comes back on, we'll get started.
Okay.
Yeah,
Maybe it's slow because it's 4 o'clock and more people are on.
that could be it.
It looks great on the network though.
Yeah, it does look good there.
Yeah. Miss Lynah, I think you may be the only person I have not met. My name is Winston McIver. I'm a physician here in Conway, and I've been a physician for right at 25 years. I did some work with the CDC when I was in Atlanta at Morehouse studying viruses, epidemiology, and biostatistics. And I went to medical school, and I've been here back home. I'm from Conway originally, and I've been back since 2000.
Okay, well, it's nice to meet you. I look forward to working more with you.
Yes, ma'am. My pleasure.
Because basically what we try to do is to educate the community.
Yes, ma'am.
On everything that's going on, as well as we also assist them with insurance. I'm a certified application counselor.
Okay.
So basically, if they need help with applying for the health insurance marketplace or Medicaid, Medicare, food stamps, and I even do a little bit of disability as well.
Okay. All right. Thank you. Thank you.
You're welcome. Thank you.
And Miss Marilyn, I've known for a long time.
Yeah.
Yes.
Everybody knows Marilyn.
Yeah. And Miss April, we went to school together, so I've known her and grew up in the same church.
Absolutely. Still in the same church. You're right. You're right. So we're going to go ahead and get started. And as of course, technical difficulties are keeping us from sharing it to a couple of other pages, but I know, right? I don't know what the deal is. Not unless they were on to us, Marilyn, because I think there was a loop that we found. May have been, I don't know, but
may have been. Try to share it directly from your page. I know I can't do it, but maybe
I'm
you
sharing
can
to the network, so I can't share from the network.
Gotcha. Okay. Yeah. I know we did it last night.
Yeah, definitely did last night, and Reddrick popped off. I don't know what happened. Maybe he'll come back. But anywho, so thank you everyone for watching today. We are actually going to perfect this and be able to do this so that we can share it to a wider audience. We were trying to do this, actually done it in the past 2 or 3 Fridays on IG Live, but it's kind of hard to convert people over to Facebook when they're used to using one form of social media. So we're glad that you all are here and listening. Please let anyone know who is interested in watching right now. We are on the network, and it is based upon invite. So if you want to invite someone to the network to watch this, that's fine. I'll do it today. But anyway, of course, we have 3 guests aside from myself, and we'll have one more joining us later, Dr. Winston D. McIver Jr. He is the primary physician and owner of Waccamaw Primary Care. Marilyn Hemingway, who is the president and CEO of the Gullah Geechee Chamber of Commerce, and Miss Lynah. Did I say your last name correctly?
Yeah.
All right, Miss Lynah. And you're with St. James Health and Wellness. You're the community health liaison. Is that correct?
That's correct.
All right. So, one of the main things we want to talk about today, of course, the impact of COVID-19 or the coronavirus in the African-American community. That is a hot topic right now. It's kind of rising to the surface. And there's a lot that's going on and a lot that's not happening in the African-American community as far as healthcare is concerned and dealing with this particular virus. But before we get started and get deep into that particular conversation, just want to let you all know you can comment. I see the comments that are coming in, and you will be able to comment, and I will be able to read your comments. But I won't be able to see your name, so I don't know who's commenting. If you want to be able to comment, you'll have to click on that link that's shown on the stream right now. So we'll start with Dr. McIver. What can you tell us about what's happening with COVID-19 as of April 10th, 2020?
Well, as of April 10th, 2020, let me kind of give the numbers in this order, because a lot of times the numbers get kind of skewed and misinterpreted, and people talking about actual numbers versus percentages. And I want to make sure that we're talking apples and apples. Okay. So first of all, I'll break this down into the world. Last week, when April and I did this podcast, there were a little over 1 million confirmed positive cases. And let me say this before I give the numbers. Every number that I give is going to be under what the actual number is. And there's a number of reasons for that. One, even though, the president's saying that, there's lots of tests and this and that, there's still people still being under tested for a number of reasons. So let's keep that in mind, that all the numbers that I give are not going to be actual numbers. They're just numbers as we have them confirmed. But there are a lot of people that haven't gotten tested. So in other words, last Friday, there were a little over 1 million people that had tested positive as in the world. Right now, there's about 1.7 million people just in the last week. The number of deaths in the world have gone from 57,000 to over 102,000 in the world. In the United States, last week this time, there was about 265,000 confirmed cases. It's gone from 265,000 to about 490,000 in the US. And as far as the deaths go, last Friday when we talked, there was about 7,000 deaths in the United States. Now there's over 18,000 deaths in the United States. So those numbers are significant. Now, at some point in time in this conversation, I can talk about the state, the counties, Orion, Georgetown counties numbers as well. I can do that now if you'd like me to.
Yes, please, go ahead. Mm-hmm.
In South Carolina, last week this time, there was about 1,700 cases, top confirmed cases. Right now, it's about 2,800 confirmed cases. Now, these numbers that I'm giving in South Carolina, the numbers as of today have not been released yet. That usually comes in about, we're usually around 5 o'clock, but it's gone from 1,700 to about 2,800 cases in a week. The number of deaths in South Carolina have gone from 31 deaths to 67 deaths in South Carolina. Specifically in Horry County, last Friday, there were 50 positive cases in South Carolina. Now there's 106 in 7 days, from 50 to 106. The number of deaths have gone from 4 to 7 in South Carolina. That's not including today's numbers. In Georgetown County, last week, there were 15 positive cases, and now there are 25. And last week in Georgetown County, there was no deaths, and there's 1 reported death now. Now, granted, I also have to say this. The labs are backlogged too. So there are a number of people that have gotten tested that haven't gotten the results back yet. And so the numbers that I'm giving are the numbers that have been reported to the state, through the state lab and the private labs that have been reported. Some of the private labs is taking them anywhere between 3 to 7 days to get the results back. So there is a backlog there, not as bad as it was before, but there is still a backlog, and there is still a significant number of people that have not gotten tested.
Okay, I want to say this real quick before we move on. I typically would not do this, but this information is too important not to share. So I'm going to open up the privacy settings for the network just for this, and we'll figure out what we'll do for next week, and you'll be able to share it. But please be mindful of who you're sharing with, okay? So I'm gonna go ahead and change that.
Now, let me say this too. Those were the actual numbers, okay? Now, let's get into the percentages for a second, okay? This past week in South Carolina, the numbers have gone from 7,000 deaths to 18,000 deaths. That's a 61% increase in 1 week. 61% increase in deaths. Okay? That's in the United States. In South Carolina, the numbers have gone from 31 to 67. That's a 54% increase in deaths in South Carolina. So this is the reason why this is so very important when we talked about social distancing. This is so very important as to, people being careful and not being out any more than they need to be out. these numbers are real. And the projections that's estimated right now are about anywhere between probably 60 to 80,000 deaths in the United States. And that's conservative. Now, that model, that number was based off of an equation that had to do with all the states being shut down totally. Okay. Now we know all the states are not shut down totally. So these numbers can be anywhere between 60,000 to 100,000. We don't know, but again, a lot of these assumptions were made that all states would be shut down.
So, Dr. Mack, you know, everybody's trying to process all the numbers that you just put out. I know I am. I was trying to keep up with everything. I think in terms of breaking it down for everyone who's watching and who's wondering, you know, on a scale of 1 to 10, from the start of the coronavirus in Horry and Georgetown counties to now, on that scale from 1 to 10, what has it risen from? If it started at a 1, and just since I guess March, maybe about March 13th.
Well, let me say this. Back when I gave the talk at Friendship Church, that was about 4 weeks ago, right?
About 4 weeks ago.
At that time, the number of cases in South Carolina was 19. We've gone from 19 to 2,800 in 4 weeks. 19 cases to 2,800 cases in 4 weeks. And again, I have to keep saying this. This is of the confirmed cases.
Mm-hmm. And confirmed means that
they've had a positive test.
They had a positive test. They were feeling ill. They went to the hospital or doctor, had a positive test, and we know for sure. But then there are people out there who haven't been tested.
Probably twice that amount.
Or more.
Okay. All right. And I have a question.
Yes.
Can these folks be sharing the virus without having symptoms? They haven't been tested and they're out there spreading this virus?
Yes, they're called asymptomatic carriers. And what's been known now is that there appear to be several strains of this COVID-19. Now, in New York, they isolated several different strains that appear to have come primarily from Europe. What happens is that the virus genome changes as the virus changes. So when you see a virus that's different from the initial virus that was found, you know that virus has been around for a while and had enough time to do some change. Now, I've gotten some calls from patients, from some of my patients, and friends of mine from across the country that said, man, you know, I was sick back in January, February, had some of these symptoms, this, that, and the other. Could it have been COVID? And it could very well have been. To go back for a second, to kind of give a little background on this, the first case in the United States was January 22nd from a person that tested positive in Washington State. That person had been in the Wuhan province in China and came back to the United States. That was January 21st. Back in January, the World Health Organization issued a statement that this was going to be a pandemic and this was going to be bad. So the United States knew about this back in January.
Okay. So, and of course, we know by now that, very little was done to contain it or even to, I guess, inform the public of what was to come or what was happening. And so now we're here again, April 10th, and there's so many people who have been infected and affected, so many people who have died, people not knowing what to do. Everyone is under stay-at-home orders. And so, it comes back to a question of what should people be doing at this point to make sure that they're not affected or infected. I know the stay-at-home orders are there. A lot of people are just, kind of defiant about it. But, what do we need to do? And of course, tying that directly to the African-American community, because there's a lot that we're not doing.
I think the first thing you have to do, and I'm not a dramatic person, and I don't want to sound dramatic by what I'm about to say, but you pretty much have to assume everybody's positive. And so unless it's somebody that you're around constantly, your family members, but anybody else, and you have to use universal precautions in that way. Strict hand washing, the same things we're talking about, using the hand sanitizer with at least 60% alcohol in it, trying to keep your hands away from your face, your mouth, and your nose. But there are a number of there will be a large number of asymptomatic carriers that may not have very many symptoms at all.
Mm-hmm.
So you just have to.
Go ahead. I'm sorry.
No, that's fine.
Oh, I was going to say, and speaking of which, that's why we have Reddrick with us today. And for those of you who are just tuning in, Reddrick is actually my cousin and lives in the Charlotte metro area. He is currently living with COVID-19. And Reddrick is here to pretty much, talk about his situation and the fact that, even with certain precautions, he still was able to be affected by this. So, Reddrick, would you share with everyone? Can you hear us? Can you hear us, Reddrick?
Yeah, I can.
Okay, go ahead.
Yeah, I can hear you. Can you hear me?
Yeah, we can hear you fine.
Yeah, my situation, well, not situation, but my interaction with the virus pretty much, it's hard to say where it actually stemmed from or where I contracted it from. The only places I can't think to remember would be in a workplace. And as much of precautions that your jobs and your companies or yourself, for instance, take towards your employees, something still gets missed because right now this is a type of virus or a negative environment where we're in where nobody has all the correct answers. I work for a financial institution and I do desktop support. So I'm definitely interacting with a lot of devices on a daily basis. And even as precautious as management had us to be, which I'm thankful for that, something still goes missing because I don't know where these devices are coming from. I don't know if they're just sitting around, who's sneezing, breathing, eating, spilling coffee, this, that, and the third, where it could come from. And that's my only backtrack as far as to me maybe contracting a positive case for COVID. The one thing I started notice was a high fever. My fever probably on a daily basis went from 102, 103. A couple of times it was getting near 104. Like I was telling April, I was like, that's that borderline point where I was scared because I didn't want to go to the hospital. Like as many relatives, friends, associates that I have in New York, a lot of the cases that I'm hearing or that you read about from what you have access to through media, you go to the hospital and you don't come back, or you end up in a refrigerated truck just to be blunt. Like it's no way to cover it up because that's what we see. That's the
And Reddrick,
scariest thing. That
you're from New York, right?
I'm from Brooklyn. Yep.
From Brooklyn. Mm-hmm. Okay, go ahead.
So just being in touch with just just being in touch with that mentally, even from some of the people who I check in today with, they haven't seen some of their relatives just because they've been admitted, and you're in one of these hospitals and it's a waiting game. And while you're there, you have these other cases, and every case is completely different. Like I said, I've talked to April, and only thing my symptoms were was a high fever. Thankfully, I was able to break the fever, recover, still recovering like I'm doing now. Thankfully, I'm off of soups and teas. I can't do no more soups and teas. I'm over that. But that's just my appetite kicking back in, which is a great thing. But it's just the symptoms are hard to play off of to really gauge, if you can compare my situation to someone else. But if one thing that you definitely can take out of my situation is the knowledge that you can educate yourself with about it, whether it's on a small scale or a big scale. Like if it's something you want to learn about or educate yourself about, you're definitely going to look into it. It was no different even with this right here with me. Like I've had millions and millions of questions, and you definitely get some negative pushback towards it. But if you don't know something, you definitely want to ask. Like I said, my biggest fear was going to a hospital, getting admitted, and not coming back home. Not even the fact of not seeing family, friends, and things like that. It's just that seems to be part of the regiment of when a lot of these individuals are going in. And there are cases where people are recovering, thankfully. Blessed to hear those that come out. But there are more cases where you're admitted and you don't see your relatives again. You can't say your last goodbyes and things like that. And that's that mental aspect of it where that play, I feel from my experience, where that plays into how well you fight to recover, how well you fight to educate yourself and others going forward. Um, it's a
just do
knowledge
what you need
piece,
to do. Yeah.
and that's pretty much the basis of it. And it's hard for some people to come to terms into what's going on just off of I guess the knowledge piece of it. But if death doesn't scare you, then I don't, I don't know what does. Because it's been a couple of times in here where I think I'm watching TV and the TV's not on, and I'm just delusional, just because my fever is running so high that you have thoughts and images just going across the TV like you're watching one of your favorite shows. So it's so much that went over in the last couple of weeks. And like I said, now I'm slowly starting to come back into a routine of functioning as best as we can in this day and age. And still just taking it day by day. Biggest thing is staying hydrated. They're trying to educate people on being social distancing, but I don't know how many stories I've seen where it's just the regular day to some people, and that's what's hurting everyone else, not just themselves. So,
Doctor, I want
yeah,
to chime in.
that's my turnaround for it. I'm not out the woodworks yet. I'm always watching on how I move still, just in case I don't want that one little flare up to come where my temperatures now it's not 8, but now it's back up over 101, 102. Like I said, and once you get to that 102, 103 point, it gets real scary. It
Okay.
gets real scary. But thankfully, I was able to have a good support team around me. From the few that did know, I definitely didn't want to have a million people worrying, but I did have a contact list as far as like emergency wise if things did get to that point where it was getting out of hand. Like my cousin, she would know exactly what to do, and then she's a bulldog. That's all I'm gonna say about that. My cousin's a bulldog, so when it comes to me, she's more than just a fighter. So for that particular individual, exactly what to do in case things did get to the point where, excuse me, I'm not taking care of myself or a situation is getting out of hand. So that my biggest right hand right there, that's the one who helped me through a lot of this and still am. So
Okay.
that's
You're
my
getting a
that's my
little
story.
winded. Yeah, you're getting a little winded. Dr. McIver, he was talking about, the
Well, you know
hospital
me,
piece. Can you hear
I'm
me?
in IT, so we don't do too much talking.
So you're just kind of out. It's an outlet for you this time. That's all right, cousin. Go ahead and talk. You probably hadn't been talking in a few days, but I do want to get Dr. McIver in here with a question and the other two guests with us.
Let me
Yeah.
say this real quick, Eric. April, I just got the latest data on it that just was sent to me. In South Carolina, the number of deaths have gone, the number of positive cases have gone from 2,800 to 3,065 today. So from 2,800 to 3,065.
So that 200 case spike, that happened overnight, or
yeah, that yesterday.
Overnight.
Yeah.
Overnight.
And the number of deaths in South Carolina have gone from 67 to 72 just in the last 24 hours.
Wow.
In Horry County, the numbers overnight have gone from 106 cases to 124.
Overnight.
And in Georgetown, it went from 25 to 28. Now, there haven't been any reported deaths in Horry or Georgetown County in the last 24 hours, but the numbers have gone up.
Okay. So something is happening, and 24 hours is not really a long time. Something has happened to make these cases spike. Do you think it's the lack of social distancing, or is it that, you know, we're hearing reports about it being airborne and people are being more affected by it? What do you think could be the culprit?
Well, I think it's just because it's numbers that were backlogged, that were tests that were waiting to come in. But remember, what we do today and how vigilant we are about this today will reflect the numbers 10 days from now. Because it takes the virus anywhere, usually between people having symptoms between 2 to 14 days on average, between exposure and symptoms. Now, it varies from person to person. That variability a lot depends on how sick the person is, what other comorbid conditions that they have, whatever other chronic conditions that they may have, would a lot of times determine that. Okay. Not always.
So, Dr. Mack, is someone like Reddrick who recovered from home, would he be counted in these numbers?
Yes. If he got tested, that test should go to the state lab, and that should be. Now, what's happened is early on, because a lot of these states didn't have a lot of tests, they weren't testing everybody. They were testing the people who were sick enough to look like they needed to be admitted. And then they would bring them in and test them. Whereas if they were presumed that they may have had it, they were just early on told to go home and quarantine for 14 days. And it was a supply demand thing. Demand was high for the test, but the supply was low.
So Reddrick, I'm glad to see you doing much better, Reddrick. I just wanted to get that in. And Dr. Mack, I had a situation where I was quarantined 2 weeks with my father because I was exposed to 2 positive cases. At a meeting. They called me and said, you got to go into quarantine, you got to get tested. Well, they didn't test me. They tested my dad because they said he was high risk. But I wonder though, am I a person that could have exposed Reddrick to the virus and he got sick without me even knowing, without even showing any symptoms, and I never was tested?
It's possible. And so that's one of the things about the medical community coming up with these antibody tests to see who in fact actually was exposed to this. Even though they may not have had symptoms, they still will produce antibodies to the virus. You know, without getting into too much detail, once you see a virus, your body mounts an immune response to it, and it produces antibodies to fight off the virus. Okay. So you can do antibody testing, and those tests will become more and more in use in the future to see how many people actually did come in contact with it. And a number of them will probably not have had any symptoms. Because remember, 80% of the people that get exposed
for me,
to it,
I had
Go ahead.
Go ahead, Reddrick.
No, I was gonna say, for me, something's
going on with your connection, Reddrick, and you're muted again if you can hear us. Okay. Oh, while you work on that, Dr. Mack, finish the thought that you,
So, you know, so 80% of the people that get this are going to be fine. I mean, going to be fine without really any major problems. There's going to be 97% of the people that do get this are going to live. There's that 3%, which is a lot compared to the fact that with the seasonal flu, it only has a mortality rate of about 0.1%. So you're talking about if you have 2% of people dying, that's 20% increase in mortality. And so a lot of people are actually looking, I'm seeing a lot of stuff on social media where people are putting up actual numbers of how many people die from the flu. They don't understand that that's just an absolute number. You have to look at this in a statistical way because we're still on the rate of rise with the number of cases that are happening. Number one. Number two, there is no treatment for this. There are treatments for the seasonal flu. Mm-hmm. There is no treatment for this now. And so that's the other reason why with a lot of these numbers floating around, they're actual numbers, but they're kind of comparing apples to pears. It's not the same thing. So we have to know whether we're talking about an absolute number versus a risk versus a ratio percentage.
Dr. Mack, is it relative for people to think about this in terms of like if you have small children and your child comes down with a virus and the doctor tells you, well, it just has to work itself out. That's pretty much how the coronavirus is behaving. And that's why you say there's no treatment, correct?
Well, there's no treatment because we haven't had any exposure to this. A lot of times the treatments and the vaccines are made based off of particles from the virus that you've seen before and you've had time to develop vaccines. Mm-hmm. That process typically takes a year or so. Anything short of that, you're fast tracking it and it really hasn't been studied. And again, that gets into the issue of, medications and treatment. But right now, that's not really anything that's out that's proven right now. I know the pharmaceutical companies are working hard, but it just hasn't come to be yet.
So this is why it makes it such a big concern that the president is pushing everybody to go back to work, but we don't have a vaccine. We haven't built up this antibiotics immunity, this herd immunity. Mm-hmm. And so I'm concerned that the danger is you send everybody back to work and we're right back to where we are right now, or even worse, because now you've sent people in and there hasn't been enough testing to see who's getting exposed, who's a carrier exposing other people. And so how do we, I know it's a little bit of a political question, but it's also a medical question.
Going back to work too soon can be an absolute disaster. Let me say a couple things. In the last 250 years, there have been 10 pandemics. Okay, 10 pandemics. These pandemics have come in different seasons of the year. So this thing about it not being a problem in the summer, that's not true. That's not true. When this first started a month ago, there were cases popping up in Australia. Australia's seasons are the opposite from ours. So they just finished summer and they were having cases. The Caribbean islands, where it's been hot, they've been having cases. So, and these pandemics will pop up. The problem with this one, like the Spanish flu, which was the worst on record in 1918 to 1920, it was the worst on record. The problem is these are new respiratory viruses that no one has built immunity to. That's the problem. And sending people back to work too soon would be a disaster. The other part of it is most of these respiratory pandemics will have a second peak to them. Usually not as bad because a lot of people have been exposed to it, but usually 6 months to 9 months after the flattening, there usually is somewhat of a rise that will happen again. The hope is that there'll be enough immunity that not as many people will get sick.
I have a question. This afternoon, the president had a news conference. Yes. And one of the things that the Surgeon General mentioned is that with African American, that there is a much higher rate. And can you talk a little bit about that, please?
Yeah, let's talk about that. And I've jotted down about 15 reasons that I can think of why that is. But let's talk about some numbers first, because I'm a math and science guy, I'm a numbers guy. So let's talk about it. The first Southern state that was considered a hot spot was Louisiana, okay? Specifically New Orleans. 70% of the people that are dying in New Orleans are African American.
You said 70%.
70. Okay. 70% of people in the city of Chicago that are dying are African Americans. The biggest outbreak outside of hospitals, biggest concentration are in the prisons in Chicago. In Milwaukee, Wisconsin, Milwaukee County, Milwaukee, 81% of the people that are dying are African Americans, and the population is only 27%.
Yeah.
Wow.
Okay, so let's talk about this for a second. Let's talk about some of the reasons why. Okay, first reason why was there was this fallacy going around that African Americans couldn't get it.
That's true.
People were looking at maps and saying, well, there are really no cases popping up in Africa. We're not seeing Africa having any cases. Well, first of all, you don't know how they were reporting. Second of all, you don't even know if they were testing there. So that's an error. If anybody can get the flu, anybody can get this. Okay, so that's the first thing. The second thing is there was a denial in our community that COVID was even real.
It still is.
That hurt. The other thing too, and I don't want to offend anybody, but these churches were still having church.
Yeah.
And I'm gonna say it. And if somebody don't like it, oh well, I don't care.
Well,
We were still having church. We were still having large funerals. That has been shown to be one of the largest sources of spread, not only just in our people, but in the United States.
right.
If you're having church, stop having live services. Go
Please.
social.
And thank
Go,
you.
go video.
Exactly.
Exactly.
So the next thing is that, lack of access. A lot of times people just don't go to the doctor for whatever reason. A lot of times our people, we just don't go to the doctors as often.
Exactly.
Another thing is that a lot of the essential workers are people of color. So let's talk about it and let's be real. Okay?
That's right.
A lot of people are still working at the Costco, the Sam's, the Walmart, gas stations, fast food restaurants, and these people have to work. They have to work.
They have to work.
If I don't go to work, I'll get fired.
That's right.
The second thing, in these urban cities, a lot of transportation is relied upon public transportation. In New York, anybody could have seen this going to happen in New York because most people in New York take the subway system.
Right.
Okay, so that's a problem. The buses, Detroit, Chicago, New Orleans, these people rely heavily on public transportation. So that's one of the reasons why. Another reason is just the lack of trust amongst our people with the medical community in some cases. Okay,
Yes.
I get it. I understand people talking about the Tuskegee experiment. Okay, I was in college at Morehouse, and my scholarship was from the CDC, and it was to educate folks of color to be in public health. Okay, I understand about the Tuskegee experiment. I get it. I got it. It's just so many reasons why this is happening, but this is not a conspiracy against us.
Right.
This is just the circumstances. But what it does is it brings an obvious picture that there's health gaps in the United States.
Exactly.
Exactly.
One of my mentors in college was Dr. Bill Jenkins, who actually discovered the Tuskegee experiment and actually exposed the United States government for this. So I get it. I understand that things have happened, but we gotta stop these deaths.
Yes, definitely.
It's this thing online about 5G causing this. What in the heck does 5G have to do with causing the virus?
Well.
Don't send it to my page anymore. Don't send any more 5G stuff to my page because that's nonsense. Okay, 5G has its own issues, but that's another talk for another day. It has nothing to do with what we're dealing with right now.
Exactly.
Agreed. One of the reasons that I wanted Lyndah to come to this broadcast is because she is the community outreach liaison for St. James Health and Wellness, which is a community health center. And our community health centers are on the front line of dealing with the health disparities that are leading to this huge impact in the African American community when it comes to the coronavirus. And a lot of people don't realize what community health centers do. So we wanted to bring Lynah on so she could talk about that and the resources that they provide. Lynah, can you just share a few words about that? What's going on with St. James? Because you guys cover all of Georgia, and of course there are community health centers in Horry County also. Your sister health centers, yeah.
Right. And as Dr. Mack stated, a lot of times people don't seek out health care because of not having health coverage. And with St. James Health and Wellness, we are considered as a federally qualified community health center, which means that you are charged based on your ability to pay. And that's determined by your family size as well as your income. Individual can pay as little as $25, and they can be seen for various services. One of the other programs that we have, thanks to our executive director, Ms. Sandra Gilliard, and the board members, if a person has what is called healthy checkup, and that's a form of Medicaid that the former Governor Haley came up with when they did not want to do the Medicaid expansion. So with that, if an individual comes in with that, we can see them for $10 a visit, which also includes their labs. As far as our mission is to provide residents of Berkeley, Charleston, and Georgetown counties access to comprehensive, high-quality primary healthcare services delivered in a confidential manner with courtesy, compassion, and respect. And in addition to that, we do provide much needed jobs for individuals in the community. One of the things that we do is we help to provide preventative care and are key to stopping our hospital systems from becoming overwhelmed. It is one of our thoughts is during these times like these, we are often asked, am I my brother's keeper? And the answer is yes. So as far as what I do, I am the individual that you would come to, and you don't necessarily have to be our patient in order to do that. If you need insurance coverage and you're not sure what kind of coverage you need, then you can call me and I will be able to assist you with that. Even with the current medical coverage that is for coronavirus, there are some things that some people are reluctant to go to the doctor because they're not sure how they're going to pay the bill. Well, there are certain tests and procedures that are covered through the federal government. So whatever you do, don't make that a reason why you're not coming to the doctor, because there are resources to see you. If you need to get in touch with me, my numbers are 843-826-3773 or 843-990-7984. And we will be more than happy to assist. We are still seeing and taking new patients. So far, thank God, we have not had any positive testing. And we're taking every steps to make sure that we're following all of the CDC guidelines. As far as when individuals come in, they give us 3 information and they go directly to the back end and are placed in a room to be seen. So if you are interested in coming to us, please feel free to give us a call. As I mentioned before, we do have sites in Georgetown as well as in McClellanville. And when you call me, I can give you the number to the nearest site that would be available for you. And as a last measure, we are doing a community health tip on Tuesdays and Thursdays at 2:00 on Facebook and YouTube. And what I am going to say at this time is to stay safe and God bless.
Thank you, Ms. Lynah. Certainly appreciate you being here in Maryland for bringing you on. I think it's wonderful to know that these resources are out there. And I know that we probably have some resources in Horry County that we can dig up and find out more information about, maybe do it on another broadcast, but keep doing the good work as far as your area. Really do appreciate it. Thanks so much for that, Marilyn. Dr. McIver, speaking of tests, Are the hospitals equipped and the doctor's offices equipped with enough tests? And is there such thing as, a quick test or, some type of test that people can take to determine whether or not they have COVID if they don't go to a doctor?
They are developing the quick test. Most of the offices don't have tests unless they're associated with the hospital system. If there's a hospital, if there's an outpatient office that's
We must be buffering, Dr. Mack. Yeah, he's buffering a little bit. Just want to go to some of the comments that are coming in while
protocols.
There he goes. He's back. Yeah, he's buffering a little bit too. But one of the things that someone commented on the thread is, mask. Oh, you're back? Are you good?
Yeah, I'm good. Everybody went blank.
Oh, okay. All right. We saw everybody except you. So
okay. Yeah.
Go ahead. Mm-hmm.
So most offices don't have the test to test. Okay. Most of the tests are coming through hospital systems, and if there are offices that are associated with the hospital, they have some protocol on how they will test. For me, I have 6 patients that have or are in the hospital that are positive. 2 of them we actually saw here at the office over 2 weeks ago. And again, we have the N95 mask here in our office, and we wear those. So it's one of those things where if you as a physician feel like this person has it and you don't have the test in the office, I actually just call the hospital and let them know, look, I'm sending Jane Doe over. She has this symptom. I want Jane Doe to be tested. And Jane Doe better be tested.
Mm-hmm.
Now, so that's what ends up happening. Again, depends on how sick the person is as to whether or not they're going to get tested. Everybody that goes to the hospital and says, can I get a test? I think I may have this. Not everybody's getting tested.
No. Someone posted test at home is the best way to stop it. Is there a test at home other than just checking your temperature? I don't think there's a test at home.
No.
Yeah, there's no test.
No.
But if you're feeling some kind of way, should a person start with at least testing for a fever?
Yeah, that's the thing. I mean, because fever, how you feel, but the difference is you're probably not going to get admitted to the hospital unless you're having some significant signs, respiratory signs. Shortness of breath being the main one, with low oxygen levels and just difficulty breathing.
Okay. I think we covered this earlier, but someone is asking as well, can a person that already tested positive recover and get the virus again?
That part we don't know. The thought is that they probably would not, because they should have built up antibodies against it. But again, we still don't know that. I mean, most people, when they get a virus, they usually will have immunity for anywhere between 1 to 3 years. And that usually kind of helps protect them. The thing about viruses, every year a virus will make a minor change. We call that a drift. Every 5 years, it makes more of a major change. We call that a shift. Every 100 years, we have something like a pandemic will happen, and that causes a major thing that if it's a novel virus, you've never seen it before.
Mm-hmm.
Sometimes older viruses can make a major enough shift that they can create pandemic-like.
Mm-hmm. I think one thing I do want to mention, because the Gullah Geechee Chamber, we've really been focusing on the environment and addressing climate change. Yeah. And with climate change and what's going on, not with us not taking care of our environment, it's releasing viruses that we assumed had died away, and it's also creating new ones. And I think this is also coming into play, and that goes to human behavior. We have to human behavior on an environmental global level and taking care of our environment so it takes care of us, but also human behavior when they tell us, wash your hands, don't touch your face, which I have a bad habit of doing. You probably saw me do it now, during this broadcast, and I've had to really concentrate on not doing that. The social distancing, these are environmental issues that I think once we get through the heat of this current pandemic, we're going to have to take a step back and really evaluate how the climate has played a part in this, because we're now having animals crossing borders and stuff that we're not crossing before, and that's definitely has to be part of the equation when we consider what's going on here.
Yeah, and there's a couple of other questions or comments that have been made. Dr. Mack, would it be possible to be positive and not have a fever?
Yes, that's the asymptomatic carrier.
That's the asymptomatic part of it. Okay. And then someone else said they're making a comment that someone that's not positive but has the symptoms will test negative, but will go out and get tested, bring it home to others. And because they picked it up while they were tested, that's a huge problem in the Northeast, is what this person is saying. So, the question has also come up about masks. Everybody is being really selective about whether or not they're going to wear a mask and how and all that. And I know that the N95s aren't really available for the everyday person, and they shouldn't be. They need to be available for the medical practitioners. But what can people do in terms of covering their faces? Should they cover their faces? Is that a better option than going with no mask at all?
Well, that's a good question, and here's the way I'll answer it. If you're going to be in a place that's a high traffic place, Lowe's, grocery store, you probably should wear something over your nose and mouth. Okay. If you're going to be out walking in your neighborhood and it's just you and your family, you should be fine. But I'm more so concerned about the people that are going into high traffic places and people coughing and sneezing and stuff. So I would definitely cover my face when doing that.
Yeah, absolutely.
One other thing I do want to mention, because I've gotten questions about this, about these medicines that the president has been pushing. Okay, so let's talk about this for a second. Okay, there are two medicines that's being talked about in the media. One is hydroxychloroquine. Hydroxychloroquine is a medicine that helps treat certain immunologic conditions, certain rheumatoid conditions, lupus, rheumatoid arthritis, just to name a few. Okay, these medicines by themselves this medicine by itself is a dangerous medicine. So let me say this. It is a medicine that is indicated for certain conditions and certain conditions only. Even with those conditions it's indicated for, it's a potentially dangerous medicine. So the American College of Physicians, the American Academy of Family Physicians, American Cardiology Association, American Society of Arrhythmic Physicians are not advocating the use of this medicine until it's proven. Okay? People are taking these medicines, and not only that, they're taking the medicines for this unproven treatment, and they're taking the medicines from people that need it for proven treatment. This medicine not only can potentially cause a heart block, cause your heart from stop beating, it can also affect your eyes, your liver, and other organs. So there's concern about that. I don't advocate the use of that, as most other physicians don't, until more studies have been done.
Yeah, and I mean, to me, that would be common sense. But as my mom used to say, common sense is not so common. Why would you start taking a drug that you have, obviously has not been tested? I mean, that's the one thing that was said, not proven. So, why would you pop a drug? But some people, I don't know, they're followers, and so they do what they do.
And again, the anecdotal studies that's been talking about with this medicine working. Remember, I said 97% of people are going to get better from this condition anyway. So who's to say these people wasn't going to get better anyway?
Anyway, exactly.
And then they could have possibly died from the so-called cure rather than letting it work its way out through the system, following the protocol that we may know or not know. Yeah.
Exactly. So one thing you definitely want to take away from this is that there is no cure. He's already said it. There's no cure. There's no treatment. It is what it is. A couple of more questions have come through. Someone said, I heard about the technique to test your lungs for COVID by holding your breath for 10 seconds. Is this a good method to use?
That's very non-scientific. I mean, if you can't hold your breath for 10 seconds, then you probably going to be sick enough, you're going to go seek medical attention anyway. So I don't, I've seen that before. There's no science behind that.
Okay. Someone else said that their daughter went the other day to get checked, and now it's being tested the same way as the flu. Is that how they test for COVID?
Well, primarily they're doing it by nasal swab, but
Nasal swab.
Right. That's the primary way, but they are developing tests to do it blood-wise to try to pick up the antibody test.
Okay. I've seen that before. Please post your comments or anything down at the bottom, and we'll definitely get to any comments that you have. But this conversation is just really good. It's something that we definitely need to have over the course of the next few weeks, months, and who knows how long. And that's the question that I have, Dr. Mack. Are there any projections as to how long this is going to be our normal?
That's a very, very good question. I mean, we're still going up the hill. I mean, we hadn't even plateaued to get to the top of the hill yet. So, that's a very good question. Again, the majority of the models that were projected, the equations that biostatisticians use, were based primarily off the whole country being shut down about 10 days ago. So I know there is a lot of social distancing being done because certain states have been totally shut down. But again, we're still going uphill.
Mm-hmm.
So, Dr. Mack, you said, it was preferenced on the entire country shutting down 10 days ago, but we know that, and you've touched on this briefly, that even South Carolina didn't shut down 10 days ago. And there's some states that still have not shut down. And just today, I ran to the grocery store quickly and back home. And the traffic was like just
Lowe's was,
it was like a
Lowe's
regular
was off
day.
the chain. Yeah, it was crazy.
It's like, and I'm wondering, I'm blessed that the grocery store for me is literally a 2-minute drive from my house. So in and out, right? But I'm wondering, where are these people going? Where are they going? So this is just creating, perpetuating this cycle. And so we really don't have any idea when this is going to end until people just stop and stay home.
Right. That's true. That's true. And so, with that, it's just one of those situations where, unless people really, stay home as much as possible, it's going to continue to take longer to get to that peak.
Okay. There's a lot of questions coming in, Dr. Mack, and even Ms. Lynah, if you have any answers. Are there any additional precautions that pregnant women will need to take?
I defer that to Dr. Mack.
Okay, just the same thing. I mean, the same thing. Just try to stay away from large crowds as you can. I mean, that's the main thing.
There's a question about a treatment that is currently being used by the Cubans. Is there any validity to that, alpha interferon?
Yeah, well, I haven't seen the studies on that. I have to say this. I was in Cuba this summer, and Cuba is well ahead on a lot of things. So I had a chance to interact with a couple physicians there in Cuba when I was there this summer, and I wouldn't be surprised if they do have something that is better than what's being used right now. But they're very cutting edge in Cuba as far as medicine goes. I haven't seen any data on the alpha interferon that they're using, but I wouldn't be surprised if there's something to it. I would say it's probably better than what we're talking about in the United States.
Okay. Someone asked, so will hot water, 80-degree temperatures kill the virus?
That hasn't been proven. So that hasn't been proven.
Hasn't been proven. Okay. All right. Please post your questions below. Thank you all so much for joining us. And the conversation isn't over. I just want to make sure that we are able to ask the questions that are important to us today. This won't be the last time that we all meet. And I'm thankful for Marilyn Hemingway for actually reaching out to me to partner with the network so that we can get this information out. We've been doing it for the past couple of weeks through IG Live or Instagram Live. And so this is kind of like home for us. This is where everybody resides here, Facebook. And so it's really good to get this information out. And I promise you next week, if we do it next week, there won't be as many technical problems. It'll be flawless. But are there ways to boost your immune system, detox, keep your body balanced is a comment that's come in.
Well, vitamins will not hurt. We don't know how much they'll help, but they certainly can help boost the immune system. Trying to get some exercise in, trying to get some vitamin D, getting outside a little bit, but doing it in a smart way, not getting out just for the sake of getting out, doing stuff and then getting back in.
Hold off on the backyard parties, y'all. Hold off on the backyard parties, okay?
The other thing I want to say too, and this is something that I've seen too a lot on social media. And I get it. A lot of people are saying, well, why aren't we focusing on the people that have recovered? Okay, let me say this. Worldwide, there's been over 375,000 people that have recovered. In the United States, there's been over 25,000 people that have recovered. And that's great. I'm happy about that. I'm excited about that. But the concern still is the cases are still going up. So it's not that medical people are downplaying the people that are recovering, because that's very important. That's beautiful, and that's what we want to happen. But as long as there's still cases that are happening and it's still escalating, and it's escalating especially in certain populations, that's where the focus has to be.
Mm-hmm. And especially within our community, I mean, that was part of the focus of what we were talking about. I think that we have there's certain things about our culture that kind of lead us in certain directions. And now is not the time to just want to do it just because we've always done it. We can't afford to do that. And even if you make the effort to educate those who may not have access or who are not as connected. Some people don't watch the news. Some people don't have any idea of what's going on in the world. They just know things are shut down and, oh, there's a virus. Okay. So, everybody has to do their part, but especially in our community, because we know that not only are there, possibilities or chances that there's some, really young people who don't get it, meaning they don't understand what the magnitude of this really is. But there's also the elderly who are not connected to social media or may not have access to information. So we got to make sure that we're doing our part. And also being just mindful and using common sense for a lot of things. Just because someone says you're supposed to do it doesn't mean that you should. And then the same thing, just if somebody says you shouldn't do it, doesn't mean that you shouldn't. But use your discernment and make sure that it makes sense for the protection of not only yourself but others, because you could be asymptomatic walking around spreading it, and everyone else is affected in the worst way, especially if you run into someone like me. I mean, I'm at risk. I'm high risk, as they say. So I have a couple of conditions that would make me high risk. I don't want to be around anyone who I feel may have been, irresponsible about who they've been around in the past few weeks. And trust me, we know who those people may be. Mm-hmm. So, just be cautious and be mindful. And there's still some stuff coming in. Thank you for tuning in, Lake Mary, Florida. We really appreciate it. Also, someone says, my household has been self-quarantined for 2 weeks without any symptoms. Thank you for all the information. That's another thing too. I asked my cousin, and I wish you all would have been able, the ones who are just tuning in, to hear him, but how would he know when it's time to go back out into the world? How would he know when it's totally over for him?
Well, typically 2 weeks is kind of that time frame, but it's 2 weeks with not having any fevers, symptoms being pretty much gone away, kind of like if you had the flu in that respect. But there's the number statistically seems to be 2 weeks, where if a person has had it, usually if they're self-quarantined for 2 weeks, that usually gives the time for a virus to kind of run its course. The person still may not feel 100% back to themselves, but at that point, they should be feeling better.
Okay. All right.
I have a question for Linda quickly. April. Linda, if I am someone without insurance and I want to see a primary care doctor and I come to a community health center, what precautions have the community health centers taken when I come to your center? Are there new procedures to protect us regarding the coronavirus?
Right. Well, first of all, if you feel you are experiencing symptoms before coming in, you need to call and speak to a provider so they can screen you over the phone to determine that. When you do come in, as I mentioned previously, the first thing is you will have to come in and get checked in. That is going to maybe take you about a minute. Previously, it would have taken longer. And then after that, you go directly to the room. That way, you're quarantined. Backing up, when you first come in, you will be given a face mask to make sure that if you do have the virus, you're not spreading it. Once you go into the room, then the provider who is geared up, and Dr. Mack can attest to this, to protect themselves, then they will come in and they will do the examination as far as doing the test to determine if you are positive or not. And if you are, then they will refer you to the hospital to get the type of care that is needed. If you aren't, then they will, recommend to you what you need to do to stay well. The other thing is if the person comes in and they don't have any kind of coverage, then they will refer them to me so I can look to see what they are eligible for and also explain to them what is available without them not being insured. Also, the other thing that we try to do is we try to make them aware of what other assistance are available in the community, such as free lunches where they can get food. And also, if they are in need of medication and they can't afford it, then we have some programs that we can sign them up for or refer them to. So we try to, at the health centers, to not only look at their health perspective, but also their financial and their personal perspective, because everything ties in together in order for them to be able to recover and stay healthy.
Thank you.
You're welcome.
Thank you very much.
I want to piggyback off that just a little bit. Please, listeners, and check on your family members. If there are medicines that they should be taking, or you should be taking, diabetes medicines, asthma medicines, high blood pressure medicines that you should be taking, please make sure you're taking them right now. Exactly. If you don't have it, call your physician's office so they can call you in a supply. But please, it's very important to make sure that you keep up with your health and your chronic medical conditions. That's very important. In my office, we're checking temperatures before you come in. We have our N95 mask, and we're taking precautions here. I have transitioned over to telehealth. So the vast majority of my visits now are video conference and telehealth. We've been doing that for about 3 weeks right now. And, right now we are doing probably about 95% of our visits through telemedicine. So that's good. I have had 2 people this past week that we video conferenced in, and I did recommend that they go to get tested, and both of them were positive. Did have a patient who I sent over to the hospital that has gotten out of the hospital now and is doing well. But I do have 2 that are in the hospital that are on the ventilator and are in very critical condition. Very critical.
And St. James Santee also has telehealth as well.
Yeah.
So, Marilyn, if you will, post the information that you posted earlier in the thread. I guess there were other health centers or healthcare centers. Okay. Someone who's viewing said, don't take the elders out unless they have an appointment. A lot of offices are actually canceling appointments right now, unless it's like a primary doctor who's doing something like what Dr. McIver is doing.
Yeah, and that's true. The hope is that more officers will go telemedicine so these people can still get their medicines. Because
Exactly.
I think there's a lot of times where patients are scheduled, but they're scheduled usually with the point of it being time to get their medicines renewed. So if these people are just canceling their appointments, sometimes they're canceling them without getting refills on their medicines. So that's very important to make sure that patients take their medicines, checking on mama, daddy, auntie, uncle, to make sure that they have the medicines that they need, and making contact with your physician's office to get them if you don't have
Exactly.
them. With lots of refills.
Dr. McIver, what's the average turnaround time to get test results back?
It's taking right now anywhere between 2 to 5 days on average. Some of the outsourced labs, because they are behind, it's taking 5 to 7 days. But a lot of the labs have now said that their backlog is cut way down and that it's taking less time than it did, let's say, 2 weeks ago.
Okay. All right. Well, there's one or two other questions, and we'll take one or two more. We're having a pretty healthy viewership, and that's good. I know people have a lot of questions, and we're here to answer these questions. If you can get on a party with DJ Turk Nice, you can get on and listen to what we have to say about COVID-19. He did a good job today, by the way. How was the Spanish flu pandemic rectified? I'm sure they didn't have vaccines then. So did it just play itself out, or is COVID kind of like that?
It played itself out. Social distancing was big, but again, the Spanish flu lasted 2 years.
Ooh.
So it went from 1918 to 1920. Over 1/3 of the world's population was infected. Hear me, let me say that one more time now. Over 1/3 of the world's population was affected. And that was before all this international travel that we do today.
Absolutely.
It was a monster.
Yeah, and this one is a beast too, because I've never seen this in my lifetime, and I know there are a lot of people on here who feel the same way. So, as much as we can do, let's try to help it round the curve. But there's a lot that we can't do, which is the reason why we have to just make sure that we're listening to medical experts like Dr. McIver, and just I guess try to eliminate or alleviate sending out too much information that sounds like speculation or theory or just downright, bogus, whatever.
Let me say this too about the Spanish flu, because it always fascinated me studying about flu. Like I said, about 1/3 of the world's population was believed to be affected. That was 500 million people. 500 million.
Wow.
Out of 500 million, it was estimated 50 million people died. 50 million. Worldwide. And about 680,000 died in the United States.
I know people have a lot of questions. So what's happening? Speaking of which, what's happening in other parts of the world? Are they starting to see their numbers decline?
They are starting to see their numbers decline. I did a podcast with a physician in South Korea about 3 weeks ago, and they are starting to see it decline. The countries that are seeing it decline had strict social distancing. I mean, they were very strict about it. But again, in Korea, they're starting to see a little bit of a trend up. Like I said, a lot of times after these viruses die down or the numbers die down, you will start to see a little bump up too. Now, part of the thought was that was a lot of people from the Asian countries that had left. A lot of them left and went to Italy and then came back to the Asian countries. So that phenomenon was part of this too. But they've done a very good job with social distancing.
Dr. Mack, will there be an indicator that we've got the all clear signal and can start with our new normal? Because I know that the governors that are all around South Carolina have extended their state of emergencies. The governor of Georgia extended his until or theirs until May 13th. Virginia is June 10th. And, you know, right now, for example, where I work, we're out as a state employee until supposedly April 30th, but that seems a bit ambitious to me. So will there be an indicator that, you know, we can get back to what we are used to?
Yeah, you know, the biostatisticians that are really following this and tracking this actually have models and equations to be able to tell when these numbers are going down. They look at several different factors, including hospitalization rates, bed usages, ventilator usages, new cases per 100,000 people. They look at population statistics as well to come up with numbers to be able to see how that curve is doing. Right now, we're still going up, but we need to see it coming down. But statistically, you'll be able to see the numbers coming down and numbers going down from what I've been quoting.
All right. Marilyn, anything special that the Gullah Geechee Chamber of Commerce is doing to educate people? You know, we want people to go to your website if you're posting information and, you know.
Yeah, thank you for asking. Within the first week of this really getting public notice, we put on our website coronavirus pages for not only for health reasons, but also for small business reasons. We're really pushing the health piece because we have to get healthy before we can go back and bring this economy back. So you can go to our website at gullahgeecheechamber.org, and that information is current. And we cover all 4 states within the Gullah Geechee corridor: Florida, Georgia, North and South Carolina. So we do encourage you to go to our website. And what we're doing are things like this, reaching out to partners and hosting live conversations to keep folks up to date with what's going on. On Sunday, Dr. Thaddeus John Bell with Closing the Gap in Healthcare. We're going to interview him 4 o'clock this Sunday. Through the Gullah Geechee Chamber of Commerce. We invite everyone to check that out also. So moving forward, we're going to be interviewing quite a few people, experts, not only from the medical field, health field, but from government, business, just talking about what's going on with the coronavirus. So we do encourage everybody to follow us on Facebook also. So thank you very much. I really enjoyed this. I think this is very much needed. And we're going to keep moving forward with this.
Absolutely.
Marilyn, please tell Dr. Bell I said hello. He's a mentor of mine. His son and I were best friends in college.
All right, very good. I will definitely tell him hello. I've worked with him when I was doing marketing at Federal Healthcare Network in Charleston, and he's still on the board there. And so I've known him for a few years. So I definitely will let him know.
Yeah, we keep in contact, and he's a mentor of mine. So, like I said, he gave me a lot of advice when I was kind of going through the process. But it's
very good.
My best friend in college.
Yeah, and he is actually someone, and I know you know this, who has been addressing healthcare disparities in the African American community for years. That's why he started Closing the Gap in Healthcare, and you know, he's on top of this. He really is.
He's a good man, and we keep in contact quite often through social media. And I talked to him maybe a couple of weeks ago, but we correspond quite often. But he's a mentor of mine, and he's a good man in a very good position.
Yes, he is. Yes, he is. Thank you.
All right. Well, hey, we've done a lot in an hour and a half. An hour and a half went by just that fast, almost an hour. And I'm sure that there's still questions that people will have. They'll probably have newer questions next week. And so Dr. McIver and I have been doing this every week, and or at least for the past 3 or 4 weeks, maybe, or 2 or 3 weeks. So you know, if again, keep watching for notices. If we may partner like this again, and definitely bring you some updates. And if you have any questions, please post them in the network. Also, take a look at the About Us for the network so that you'll know what this group is all about, and encourage people to join who fit the culture of the group. And I think that I'm just sitting here, I've got some ideas on some things that we can do moving forward. Maybe even talk about how, some of the small businesses, entrepreneurs who are trying to figure it out right now, how we can all support them as we go through this COVID-19 crisis. So maybe that'll be the next stream that we have. Marilyn, you want to help me with that?
I certainly do. I got members out there and just folks in the community who are really hurting, but there are things that we can do to help these small businesses.
Yeah, I think that's next. And talking about even some of and I don't know if the funds are still out there, but the money that's available and the resources that are available for small businesses to help them bounce back. We really need to talk about that because you all need to understand what's underneath it all. So thank you so much. I appreciate you, Dr. Winston D. McIver Jr., Mac Jr. Welcome, my primary care. Thank you so much, Ms. Lynah. Did I say it right?
Lynah.
Linda Lynah. That's real catchy. Linda Lynah. And St. James Health and Wellness. Thank you so much. And
thank you for having me.
You are absolutely welcome. And the superstar Marilyn Hemingway, you are doing big things, my sister. Everybody's watching. Keep doing what you're doing. Gullah Geechee Chamber of Commerce President and CEO. And of course, I'm April Garner, founder of the network. Thank you all for tuning in. And this will be available, hopefully, if Marilyn and I get it right, it'll be available for you to share because it was recorded. So you can always pass it around, download it and pass it around. But thank you all so much.
Thank you all for having me.
Bye-bye, everybody. God bless.
Wash your hands, wear your mask.
Yeah.
All right, take care.
Take care.
Good night.